Hi, I'm Jasmine, Practice Manager for Watertown, and I'm excited.
Hi, I'm Patty Howard, Talent Acquisition Manager at APDerm, and I'm excited. Woohoo!
Hi, this is Mark Lemke, IT Director for APDerm, and I'm excited.
Hi, I'm Marina. I'm a medical receptionist in Watertown, and I'm excited.
Hi, I'm Lori, and I'm a medical assistant here at APDerm Wayland, and I'm excited.
Hi, I'm Claire. I'm a medical assistant in Watertown, and I'm excited.
Hi, my name is Maria. I'm the medical receptionist in Watertown, and I am excited.
I'm Lindsay, scheduling manager, and I'm excited.
My name is Michelle, and I'm in human resources, and I'm excited.
Hi, I'm Adressa. I'm the medical receptionist in Wayland, and I'm excited.
And I'm excited to welcome you to the grand opening and ribbon cutting of the APDerm Wayland location and Watertown expansion. Tonight we are following strict COVID protocols, but I will remove my mask for clarity purposes. Just remember the rest of the attendees will either be wearing a mask or at a safe social distance. Also remember that today all viewers can take advantage of a 10% discount on online orders. Tonight we'll be raffling off a few different items, one being a gift basket from Elta MD and or gift certificates to La Bodega in Watertown and Coach Grill in Wayland. To enter, please enter your full name below, and we will be announcing the winners throughout the evening. Tonight, we'll be hearing from Rich Ni, CEO of APDerm, as well as Dr. Ho, Dr. Liu, and Dr. Schwarz. We will be doing some tours of the facilities. We'll also hear from our clinicians. We have some great prizes in our raffle. Beth from Elta MD will be teaching us about winter skincare. And we're also going to have an opportunity for viewers to ask our physicians some questions. The APDerm ribbon cutting ceremony is about to start, so I would like to introduce Rich Ni, CEO of APDerm.
Adrian, thank you very much. And I love the enthusiasm. When you can have enthusiasm and display that even with masks on, that is something special. You know, we all love open houses. It's a chance to get together and see people and see things, maybe have a glass of wine. Obviously, that's not the opportunity here during COVID. We take COVID precautions very seriously at APDerm. And so, as Adrian mentioned, we can't do those things. But we do appreciate everybody joining us this evening and getting a little flavor for how we're expanding access to care in some new areas and expanding where we already had some care, which is Watertown. So really excited to continue expand and allow more access for our patients. Adrian mentioned Wayland. It's a beautiful location. It is right across from the Stop and Shop in the Wayland Town Center. And Dr. Ho is going to be practicing general dermatology as well as cosmetic dermatology there. So we're super excited by that. In addition, we're going to be focusing and talking to some of the providers at the expanded Watertown location. Many people know Dr. Haas and Dr. Grassi, who have been there for a long time, built a lovely practice, but they had more patients than they could deal with. So we've expanded, and a couple of new physicians are joining us, new to our group, Dr. Liu and Dr. Schwarz, and we're super excited by that. You know, if you're a patient listening, feel free to go online to book an appointment via our website. It's a new tool that streamlines ways into the practice. So again, I'm sorry that we can't be together in person, but this is the next best thing to have our virtual ribbon cutting. So with that, I'll turn it back over.
Hi, welcome to our newest APDerm location in Wayland, Massachusetts. Come with me. Our Wayland facility is located in the Wayland Town Center. And when you walk in, we have a large and spacious reception area, as well as products to purchase, like sunscreens, cleansers, moisturizers. This location does have 9 exam rooms, and we'll be offering services for general dermatology, cosmetic dermatology, as well as phototherapy treatments. And as you can see, our exam rooms are nice and spacious, comfortable for any treatment that you may need. Follow me to the checkout location where we have receptionists to schedule your next appointment, or again to offer you any purchase of products, sunscreens, moisturizers, lotions. Congratulations on the opening of the new Wayland location. Could you tell our viewers more about the new office?
Yeah, so we have a brand new clinic located in the Wayland Town Center, right across from the Stop and Shop. We're open on Tuesday from 9 to 6 and Thursday from 8 to 5. And we've got 9 brand new clinic rooms. Just excited to see patients.
Great. What services are performed in the new office?
So we offer the full range of medical dermatology and also surgical procedures here, as well as cosmetic procedures like Botox, filler, and lasers. And I'm very comfortable and experienced in seeing patients of all ages, from newborn kids all the way up to older adults.
Could you tell our viewers some of APDerm's COVID precautions?
Yeah, so we have an online check-in process, so it's totally contact-free. We have patients waiting in their car, and we call you in right when we're ready to see you. We also do temperature screenings. We ask that all patients wear their masks at all times, and all staff are as well. And we're very, very happy to say that all of our staff are vaccinated as well.
Awesome. What are you looking forward to?
So I'm actually from the area. I grew up just next door. So I'm extremely happy and excited to have moved back home, and I'm just ready to take care of the community that has done so much for me.
What are your special interests?
Like I said, I just love dermatology, so I love medical derm, surgical derm, and cosmetic derm, but I do have a particular interest in more complex medical dermatology, especially with rheumatologic dermatologic diseases. So I'm very happy to see patients with kind of more complicated medical histories and just do a good job taking care of them in partnership with their other specialists and providers.
Great. When you aren't at the office, what do you like to do during your spare time?
Yeah, so I really just have one main hobby. You'll find me at the gym 6 or 7 days a week, a couple hours a day. Always happy to talk about health, fitness, nutrition, and I think all of those things are part of really a healthy lifestyle, and all of that's very important to me.
Excellent, thank you. And now we'll be announcing the winner of the Coach Grill gift certificate. And now I'd like to introduce Heidi, our cosmetics director, and Beth from Elta MD to give us some tips on winter skincare.
Ready. Welcome everyone to our Wayland Watertown grand opening for APDerm. My name is Heidi Kidd. I'm the Director of Cosmetic Services, and I'm pleased to introduce Beth Cadigan from Elta MD, who's going to discuss winter skin with us.
Thank you for having me. It's a pleasure to be here. Congratulations.
Thank you, Beth. So Beth, now that winter is here, what are your recommendations for dry skin?
So that's a good question. Number one, of course, as all the providers at APDerm would agree, is SPF. And what's unique about the sunscreens that you carry here from Elta MD is that there's one for every skin type. These are some of the examples of the ones that would be optimum for that winter, more drier feeling of the skin that it gets during the winter time. So these would be very hydrating. And then we have things for combination skin, But you do want to remember your SPF. Those UVA rays are out even when the sun is not out. So you want a good protection each and every day to prevent against that damage. So some of the sun care items that you have here can double as a moisturizer / sunscreen even in the wintertime. So start with the SPF, and then of course you want your moisturizers and your hydration, such as a hyaluronic acid serum.
When would you suggest the best time to moisturize is?
So optimally, I think the best time would be, suggested time would be when you come out of a hot shower, because your pores are more wide open, so whatever moisturization product you're using will get down deeper into your skin. But you can certainly moisturize any time of day. Some people just feel drier at certain times during the day, depending on where you are and if the air is on and whatnot. So any time is fine, but really fresh out of a shower is the optimal time you can.
Okay, so, and I guess how often then can you, is it okay to moisturize frequently? I know that during COVID, I'm washing my hands a lot. My hands are feeling very dry.
Yes, so you can, and of course we all are washing our hands more these days. But certainly if you're using, depending upon the products you're using, if you're using a serum, which will go on first, you want to remember the rule of thumb is thinnest to thickest when you're using moisturizing or hydrating products. So if you're using something like our hyaluronic acid skin recovery system serum, and this is great for that skin that we all have these days, maybe that has some maskne, or no matter what skin type you are, this is great to use before you put out anything else on your skin. This will hydrate, but without adding oil to your skin. So you'd put this on first, and it helps with any irritation you may have. And then you'd use your favorite either sunscreen that's doubling as your moisturizer, or you can use one of our moisturizers after that. But really, and then reapply as you need during the day.
Are all moisturizers created equally, or?
No. So again, that's why you have different options in the practices for moisturizers. Two of them here, the PM therapy and the barrier renewal, are going to be more for that normal to dry skin, anti-aging that maybe has had some laser treatments or some other treatments, and you're trying to build up that epidermis or stratum corneum that's been disrupted with treatments, in a good way, of course. That's going to help more of an anti-aging. The AM therapy actually has willow bark in it, so it's going to help with that skin turnover. So that's good for all skin types, but especially the normal to oily. That's the lightest one we have, but it also helps to build up the thickness of the epidermis too. So depending upon the skin type, your provider or your esthetician will recommend the one that's right for you.
Okay, great. And do we need to moisturize more as we age?
Definitely, but about the moisturization, it's definitely about the hydration too. So you want to make sure you have a product when you're aging that has a hyaluronic acid, which is a product that's going to hold that water in. So it's not adding oil to your skin, but it's providing that extra hydration. So even if you're using a moisturizer, typically as we age, we need to replace those lipids or fats that are normally in our skin that start to deplete as we age, and of course the collagen depletion as we age. So when patients present to get aesthetic treatments to work on some of those issues that they maybe have, fine lines and wrinkles or aging, they definitely want to go home and use a product that's going to support those treatments and help to, work through while you're in between treatments too. So it's definitely important to have a good skeleton crew, especially as we're aging and if we're investing in aesthetic treatments.
Mm-hmm. So as it starts to warm up, should we change our moisturizer?
Oftentimes, you really need to. Now, if we lived in a part of the country like in Arizona where it's typically just dry air, whether it's hot or colder, the air is very dry there, you wouldn't have to change them as much as we do here in New England, where we live in an area that can get very dry in the winter and very humid in the summertime. So you definitely have to have a few products that are interchangeable depending upon the time of year. Again, going back to the sunscreen, we have ones that are definitely lighter, sheer, more appropriate for that normal to oily or normal to humid type of weather where you don't like that heavier feel on your skin in the summertime. And then in the wintertime, the ones that have moisturizers and hydration built into them that are more appropriate for that drier skin. So you do have to switch it up. Not 100 products, but a few good ones that are interchangeable for the different weather, I would definitely recommend.
Great, very informative, Beth. Are there any other products there that you want to show us?
So this is a great product. It's very, very popular. It's good for all skin types. It's called Foaming Facial Cleanser. This is sort of the star of the show for Elta MD. Because one person brings it home and the whole family ends up using it. It's got anti-inflammatory enzymes. It cleanses, it can remove makeup, but without irritation. It doesn't have any exfoliating acids in it. It just gently cleans, doesn't leave a film, and is non-drying. So this is great in the summer and the winter. This is one of those products that is going to be great any time of year. And of course, the lip balm is important. It's an SPF 36. That's good for the beach, skiing, anytime.
Yeah, and it's hard to find a lip balm with that high of an SPF, so that's fantastic.
And then our newer products, of course, I pointed out one, and we also have a light moisturizer. They're called the Skin Recovery products. We just recently came out with those, and they've been extremely helpful for irritated skin post-procedure that's red and just, extra sensitive, or even people that have rosacea, acne. It's hydrating yet calming. Also has our triple amino acid patented technology, so it helps to heal that stratum corneum. Very good for all skin types, in a solution that helps to detoxify the skin. So really something for everybody.
Great, thank you so much. We've enjoyed this. Thank you all. And if you would like to purchase any of these products, please go to our online store at apderm.com.
Welcome to our newly expanded Watertown office, located in downtown Watertown, right in the heart of Watertown Square. This is our waiting room for our Mohs surgery patients. Our Watertown office is now offering Mohs surgery in addition to general dermatology and cosmetic services. In this location, we have 6 brand new exam rooms. And this is our Mohs lab. And in addition to general derm, cosmetics, and Mohs, we are also offering phototherapy services. Thank you for joining me on a tour of our Watertown expansion. We hope to see you soon. Congratulations on the opening of the newly expanded Watertown location. Could you tell us what you're looking forward to?
Well, thank you so much. Yes, we're very excited about our new facility here at 40 Spring Street in the heart of Watertown Square. I think this expanded space is going to service the needs of the community. We're offering Mohs, we're offering phototherapy, a variety of lasers, photodynamic therapy, as well as cosmetics.
Great, and could you tell us a little bit about your experience in dermatology? What areas do you specialize in?
Sure, I've been practicing for 13 years now, and I started off at the Beth Israel Deaconess Medical Center. I did leave Boston for a decade out to the San Francisco Bay Area. I was practicing at Kaiser Permanente, but very excited to be back and joining a fantastic community and also company, Adult and Pediatric Dermatology and Associates in Dermatology. So I see patients of all ages. I do general dermatology with a specialized interest in skin cancer screenings, preventions, and treatment by dermatology surgery. And I also do offer cosmetics, including Botox, microneedling, and laser.
Awesome. What are the office hours for the new location?
So we're open from Monday to Friday from 7:30 a.m. until 5 p.m.
Excellent. And when you aren't in the office, what do you like to do during your spare time?
So I like to spend time with my family. That's my wife. I have a 7-year-old son and a 5-year-old daughter, and we like to go out and enjoy nature, camping, traveling, and on my spare time I also like to play golf and I like to cook.
Excellent. Thank you so much.
You're welcome.
Congratulations on the opening of the newly expanded Watertown location. Could you tell us what you're looking forward to in terms of the new location?
Oh, sure. Well, I'm really excited to be in Watertown. I just completed my training at Boston University, so we were more in the Boston and the more urban area, and it's nice to be in Watertown and with a different patient population.
That's great. And Dr. Schwarz, we know you're a general dermatologist, but do you have any particular clinical interests?
I do. I really enjoy seeing acne patients. I think it's very gratifying to see them when they first come in and maybe not doing so well, and then with treatment they get a lot better, and it's fun to see them back.
That's awesome. When you aren't in the office, what do you like to do in your spare time?
I love to go skiing. I used to go last winter. This winter, not so much because of the pandemic, but hopefully maybe towards the end of this season or next winter.
Great. Well, thank you so much.
Thank you.
And now we'll be announcing the winner of the La Bodega gift certificate. And now Dr. Liu is going to perform a microneedling procedure.
So today we're going to do some microneedling for you. Do you have any questions?
Yeah, so this is my first time doing it, and I just wanted to understand how long it's going to take and some of the side effects.
Yeah, sure. So first, the microneedling to review is this technique where we're using what's called a skin pen, and on the top is a cartridge with all of these surgical grade and of course sterile needles. And then so they will be going in at a certain depth that we are able to decide and control. And then so they're basically doing like little, pinpricks into your skin. And this is to stimulate collagen. So it's really a good technique for skin rejuvenation and also to treat acne scarring. I think those would be the two main things that we look to use it for. Now, in terms of how we'll do this is we'll get you numbed up for 30 minutes with a numbing cream for your comfort. And then the procedure itself only takes 15 to 20 minutes to treat for your face. There's very little downtime. The downtime is about 2 or 3 days where you are going to be red and kind of look almost like you have a sunburn. But, we'll give you some products to use and to take care of your skin. And any other questions?
No, that all sounds great. I'm very excited. What about the results? Should I be able to see results immediately after the redness goes away?
So that's a great question. I think that the results for a procedure like this are on the subtle side. It can take several treatments spaced a month apart to get the results that you might be looking for. And a lot of this is kind of preventative. So if it's not something that you see the results for, today or next month or next year, then it's something that pays dividends, decades later.
Perfect. That all sounds great.
Hi, I'm Kelly. I'm a medical assistant here at APDerm. I'm just going to get Jeannie comfortable in the chair here while we apply the numbing cream. Your legs are going to be coming up as well. How's that? Are you comfortable?
Yes, perfect.
Can I get you a pillow for your head?
Sure.
There we go. And rest right on down.
Thank you.
How's that?
Perfect.
Beautiful. Do you have any makeup on your face currently?
I do not.
Okay. Might just smell a little funny, but other than that. Now I'm going to apply the numbing cream. So it kind of just sits on top of your skin for 30 minutes. And I'll just massage it right into your skin.
Yeah, that's fine. You can put some. You can just get. I can do some of it smoothing of it. Yeah, you can try just put it and then smooth. Okay, here we go. You ready? Do your upper lip first.
Now is time for the Ask a Physician segment of the evening, and Heidi is going to be our host.
Good evening. Thank you for attending APDerm's Wayland Watertown virtual grand opening. We are about to begin our Ask the Physician portion of the program. You can submit your questions to the physicians in the comment fields. I would first like to welcome Dr. Byron Ho, who is a board-certified dermatologist working in our Wayland location. This evening, Dr. Ho will be speaking about treating psoriasis and joint involvement screening evaluation. Thank you for joining us this evening, Dr. Ho. Please tell us more about psoriasis and joint involvement.
Hey, good evening, everyone. Thanks for joining us today. Very excited to be here and announce the opening of Wayland to everyone. So yeah, psoriasis is a pretty common chronic inflammatory condition where the immune system often kind of attacks the skin and creates a lot of inflammation and rash. But it is a condition that can affect really the whole body and kind of the whole health of a patient. So, and I think it's important for people to know that, because oftentimes the skin is, a window into a person's health and helping them. So, a lot of the time in terms of what it looks like on the skin, often it's like very red, scaly, thick plaques on people. It can affect really any body part. And certainly if anyone, had a question about, oh, is this psoriasis or something else, we're always here to help answer that question and figure out what to do next. So, psoriasis kind of most known for involving the skin, but like I mentioned, it does affect a person's overall health. And so that's part of why it's quite important to treat. It can affect kind of diabetes, cardiovascular disease. There's some very good evidence out there that treating severe skin psoriasis can actually help a person's cardiovascular health in that situation. And of course, the other thing I wanted to touch on was psoriatic arthritis. So psoriasis, kind of the most other common area of involvement are a person's joints. And many people may not know this, and they kind of sometimes chalk up their aches and pains to kind of, I know patients say to me all the time, oh, I'm just like aging, this is just normal. But sometimes it's not normal, and we need to listen to our bodies and really investigate and be sure that there's not something else for us to be treating. So about 20 to 25% of patients with skin psoriasis can have psoriasis in their joints. And that really has nothing to do with what people think of as like a normal aging process. We can actually intervene on that quite well and really help preserve joints, symptoms, function, and being able to live like a happy, healthy, active life. Usually people with psoriatic arthritis will have skin psoriasis, but there's actually not a great correlation for how much skin psoriasis someone has and how much their joints might be involved. So that's another reason why it's important to get in with your dermatologist so that we can do screening and examine the joints and ask about your joint symptoms. And if needed, we can do blood work and imaging to help us get to the bottom of it. So again, thank you all for joining. I hope some of that was helpful for people. And if anyone ever has any questions, we're here to help.
Thank you, Dr. Ho, for your presentation on psoriasis and joint involvement. For those of you who have questions, please submit them in the comments field.
So I do see one question here about links between COVID and psoriasis from Tim Dolan. Thanks for that. That's a great question. So in terms of psoriasis being a risk for severe COVID disease, as far as we know, it does not seem to be. So psoriasis patients do not seem to be at higher risk of COVID. However, a caveat to that is some of our severe psoriasis patients we put on immunosuppressing medications. There was actually a pretty good study done out of the rheumatology groups internationally that had not found evidence of severe COVID in psoriasis patients on immunosuppressants, but kind of no one would hang their hat on that kind of small data set to tell patients that they're really not at increased risk. So we still tell all of our psoriasis patients on biologics and immunosuppressants to take all the precautions we think everyone should be taking right now. But so far, nothing alarming has come up in the data. And in terms of getting like COVID vaccines, patients with psoriasis should feel very comfortable that they are able to safely get the COVID vaccines. And we haven't seen any evidence that they would respond any differently so far. A question from Angela Wayne. Do you offer telederm visits? Thanks for the question. And yes, absolutely. I'm available Monday through Thursday for telederm visits, really anytime during the day. So if you just contact our offices, we can find a time that works for us both. And then a question from Lori Lindemann. Any recommendations for extremely dry skin? Thanks for the question. Yeah, so I think a lot of patients and people in general are always wondering, oh, like what's the best moisturizers to use, or what should I use for my dry skin? I think generally anything that you like is what I tell most patients. The important thing, especially for like young kids, it's finding something that people enjoy using and like putting on their skin that they find helpful. In terms of the things that tend to do better and be more effective for dry skin, basically heavier creams or even like a Vaseline base or a thick Aquaphor, those tend to work the best, but it's the trade-off of whether or not people like having Vaseline on their skin. And many people do, but some don't. In general, lotions tend to be thinner and not as effective. So typically things that come in like pump bottles won't be as moisturizing as things that come in tubs or kind of ointments that come out of tubes. Those tend to be more effective. But if you find a product that you like and you find helpful, I'm all for it.
Dr. Ho, I was texted a couple questions here. It says, does psoriasis affect all age groups?
Yeah, great question. So psoriasis can affect all age groups. So this does include infants all the way to our older adults. Typically, most patients will get their kind of first present with psoriasis and start having symptoms and rash, usually in adolescence or young adulthood. And then there's a second larger group that tend to get it in middle age and later in life. Those are the most common time periods to get psoriasis, but really a person of any age can get psoriasis. So if there's ever a suspicious rash in general, like we would love to evaluate it and help out. And then if it were, if we thought it was psoriasis, certainly we would treat it that way and investigate for other kind of other involved organs and always evaluate the joints.
Okay. Oh, here we have another one.
What is my feeling about consuming collagen for anti-aging purposes? Thanks for the question, Joan. I think collagen supplements have become very, very popular in the last few years. So to be honest, I have looked at the literature for collagen supplements. I would say that the evidence that they help for anti-aging is not particularly strong, but I think if the patient wanted to try it and they thought it was helpful, I would never discourage that. I think if you try it for a couple of months and you haven't seen much improvement or kind of like what you were looking for from it, then I would kind of not continue the investment. I don't think you should force yourself to do it because you feel like you have to. But if you find it helpful, then absolutely you can keep going.
Okay, and I do see, oh, there we have another question. Okay.
What do you find is the best treatment for melasma? From Rita Bean. Thanks for the question. So melasma can be quite difficult to treat. So this is a condition where there tends to be brown, kind of extra brown pigmentation around typically the face, often in women, but men can get this as well. and it is often happens around changes, periods of life where there's changes in hormones. So pregnancy is a common time, and menopause can be a common time for women as well. So there's a lot of different treatments for it. So there are topical therapies, several different creams to help try to kind of exfoliate out some of the pigment and prevent more pigment from getting deposited. And of course, sunscreen is always number one for any pigment disorders. After that, there are laser therapies and peels that can be helpful for melasma, but you do have to be very careful, especially when doing lasers for melasma, because there is always a small risk that it can make it worse instead of better. So you want to be in the hands with one of our experts here who are very comfortable treating melasma with lasers. And then for very severe cases, there are a couple pills that we could always discuss more in clinic and require some monitoring. Let's see, the next question. What do you recommend as a treatment for children who are constantly washing their hands with antibacterials in school? From Ashley. Thanks for the question, and sorry to hear about your hands. Yeah, definitely a very common problem in the wintertime, in the COVID era, unfortunately. Washing our hands frequently, while definitely good for good hygiene and protecting ourselves and other people, does strip off the natural oils that keeps our skin moisturized and protected. So putting on a good heavy hand cream immediately after washing hands is the best way to protect yourself there from the red raw hand. So I would give your daughter a good tube of ointment that she likes to use to have on hand. What lasers do you offer in the Wayland office? From Ashley Wells. Thanks for the question there. So yeah, I'm very comfortable using essentially PDL lasers, which are for red spots and blood vessel type lesions and rosacea, for example. We also have different, you may have heard of ND-YAG lasers. So those are used for tattoo removal sometimes and pigment removal, such as melasma and other like pigmented lesions and facial lesions. We have rejuvenation, kind of full face or neck rejuvenation lasers available as well, and hair removal lasers also.
Great. Thank you, Dr. Ho, for your presentation.
Yeah, thank you.
And have a good evening.
Thanks, everyone.
Next, I would like to welcome Dr. James Liu, a board-certified dermatologist with Associates in Dermatology in Watertown. This evening, Dr. Liu will be discussing sun protection and skin cancer surveillance. Thank you for joining us this evening, Dr. Liu. Please tell us more about sun protection and skin cancer.
Thank you, Heidi. Can you hear me okay?
Yes, thank you.
Okay. Thanks, everyone. I'm very pleased and excited to be here for our new Watertown office virtual grand opening. And first, I just want to thank everyone for attending this evening's event. I did want to briefly cover and review the topic of skin cancer prevention and surveillance. So the foundation of skin cancer prevention is, of course, protection against the harmful ultraviolet rays of the sun. And while you're preventing your risk of getting skin cancer, there's a huge bonus built in, and that is sun protection is automatically anti-aging protection as well. So unless you're a teenager or in your 20s, I think everyone likes to look younger than their actual age. So I find this can be a good motivating factor for some of my patients. So what are the basics for sun protection? Is it liberally apply an excellent high SPF sunscreen and then go lay out by the pool? So I get this scenario a lot and I hear from my patients, but I love the sun. And my answer to them is always the same, and that's yes, but the sun doesn't love you back. So a lot of attention is paid to sunscreens for sun protection. And of course, dermatologists were always encouraging sunscreen use with good reason. But I always like to tell my patients that sunscreen is their last line of defense, not the first. So I like to think about sun protection in this order. And the first is avoidance. So if the sun is blazing hot out there, maybe just stay inside. Some cool AC, nice book or Netflix show. So that would be number one. But of course, I'm not advocating that you live in your basement. Definitely go outside, get fresh air, enjoy outdoor activities. So one strategy here is maybe trying to limit those activities to times when the sun is less intense. That'd be before 10 a.m. or after 4 p.m. So if you can't do that, then the next step would be seeking shade where possible. So on a sunny day when I've been stuck at a crosswalk trying to cross the street, I've literally tried to stand in the 2-foot wide shadow of the traffic light pole. And I will make the effort to cross the street to the other side if the other side of the street is shadier. So if you're at a beach or a park, having an umbrella for shade would be great. So the next line of defense after avoidance is going to be protective clothing. So if you can't get that umbrella at the beach, or you think you'd look silly, walking with an open umbrella on a sunny summer day, then a wide brim hat is going to be your best friend. So there's really a lot of good and fashionable brands out there: Tilly, Wallaroo, Sunday Afternoons, etc. So there's also really great protective clothing for the beach or for hiking. They make long sleeve rash guard shirts for the beach, and then lightweight, breathable, long sleeve shirts for outdoor activities. So, and then finally, after that, then we get to sunscreen. So, of course, definitely we recommend a daily facial sunscreen year-round, SPF of 30 or higher, and broad spectrum. And with this, don't forget your ears and neck, because we see lots of skin cancers that develop in these areas, and people generally will do the face and forget those areas. And then if you're going to be out and your skin's going to be exposed and you can't do either the avoidance or the protective clothing, then definitely apply a sunscreen. So here I do recommend finding the highest sunscreen SPF possible. So in the lab, there isn't that much difference in added protection from the higher SPF numbers, but in the real world, studies have shown that the higher SPF is more protective. And this is probably because people usually don't apply enough sunscreen to get that stated protection that they think they're getting. So now very quickly about skin cancer surveillance. Basically, if you or someone in your family know a mole that's changing in the size, color, or shape, then definitely please come in to see me or see one of my colleagues. And if you notice any skin lesion that isn't resolving after a month, or a sore that bleeds easily, then definitely go see a dermatologist immediately. So otherwise, please come see me or one of my colleagues at Adult and Pediatric Dermatology, about once a year, and we'd be happy to do a full body skin cancer screening for you. Thank you.
Thank you, Dr. Liu, for teaching us about sun protection and skin cancer. If you have any questions for Dr. Liu, please submit them in the comments section.
Okay, great. So I do see a question from Gail about what about UVB light treatments for psoriasis. So I think the question here is that ultraviolet B light for treating psoriasis, does that increase your risk for skin cancer? The studies have shown that there really hasn't been any kind of significant increase in, skin cancer from these ultraviolet light treatments for psoriasis. So I think that you could rest assured that if you're doing that, but we certainly do also keep an eye on our psoriasis patients that are getting ultraviolet light treatments, and we'll do skin cancer screenings for them as well. Okay, I got another question from Jasmari. Should I use different sunscreen on my face than the rest of my body? That's a great question. So generally, I do recommend the sunscreens that are, kind of dedicated for the face. So I do separate out the ones that are for the face and for the body. Okay, and then another question from Michael. Do face masks absorb sunscreen lotion? Should I apply more than once a day? Oh, okay, so this is the COVID face mask. I assume that we're talking about. So I don't believe so. I think that in terms of application of sunscreen for more than once a day, definitely apply a good facial sunscreen in the morning before going out. Reapplication is never a bad idea, especially if you're going to be out for prolonged periods. Generally, if you're going to be out in the sun, for the entire day, the recommendation is to reapply every 2 hours.
Yeah, Dr. Liu, I had a similar text come in asking if the person needed to wear sunscreen even though they're wearing a mask.
Well, I think that it's a good idea. Certainly the face mask, as we were talking about protective clothing, is probably providing some protection there against the ultraviolet rays. But I think it wouldn't make too much sense to, just apply to your forehead and above the mask. So I would recommend applying for the full face. So there's a question here from Angela. Are there any vitamins I can take to ward off future skin cancers? I've heard about nicotinamide. So that is a great question. And so that is true that is something that we can recommend for suppression of precancerous growths called actinic keratoses and also squamous cell. So that is something that you can potentially take.
Dr. Liu, here's another question that came to me via text is how would you treat severe sunburn?
Sure. Well, I guess if you get to the point of sunburn, then we haven't followed the recommendations. It's a little bit tough. At that point, it's mainly just kind of comfort care. So you can use some cold compresses, taking some cool baths. I think, aloe is fine. A little bit of hydrocortisone can help, and really just pain relievers and just taking it easy and redoubling your efforts for sun protection for the next time. Okay, another question from Clara. Can we use the same SPF in the winter as in the summer? And the answer is definitely. You could definitely use the same. So we're still getting ultraviolet rays in the winter. Of course, it's not as intense as in the summer, but we do recommend sunscreen and sun protection year round. Okay, and then from Michelle, different topic. Do you have any recommendations on how to treat your skin after it's been in a cast for 2 months? Okay, I'm not quite understanding the question, unfortunately. So I guess if your limb has been in a cast, and I'm not sure if it's just dry, I think probably a very good moisturizer would be a good idea, as Dr. Ho had mentioned.
Okay, thank you very much, Dr. Liu. We appreciate your time. Have a good evening.
Thank you, everyone.
Okay, and finally, I would like to welcome Dr. Peggy Schwarz. Dr. Schwarz is a board-certified dermatologist with associates in dermatology, also located in our Watertown location. Dr. Schwarz will be talking to us about acne this evening. Thank you for joining us this evening, Dr. Schwarz. Please tell us more about acne.
Hi, Heidi. Thank you for having me. Can you hear me okay?
Yes, thank you.
Okay, well, thank you for everyone for joining. Yes, so today we're going to talk about acne. I'm sure we're all familiar with it, but I'd like to talk a little bit more about the specific types and the treatments that we can do. I find that acne is something that people, can post about online, or, and sometimes the advice they get, I read it and I kind of cringe at the lay advice that's out there. So just to talk about it a little bit more. I'm sure we're all familiar with the concept of acne, and it's a disorder of what we call the pilosebaceous unit, which means the little hair follicle and the little oil follicle that deposits into that hair. And I'm sure most of us know already that acne tends to affect the younger population. You know, as we hit our teens and puberty, it tends to flare up, but it can continue. In fact, 12% of women in their 40s and 3% of men in their 40s will continue to have acne. So it's not just a disorder of young people. So as far as types of acne, there are a few different types of acne, and I'll go through just a few of them. The first type is comedonal acne, which is more known as closed comedones or open comedones or blackheads or whiteheads. That type of acne, very common on the forehead, especially if you're using like a lot of oils on the hair. Sometimes it can come down and kind of clog the pores. We have a lot of treatments for that. Some of them are over the counter, some of them are prescription, and we like to tailor each acne patient to have their own regimen. So comedonal acne, usually topicals work, fairly easy to treat, a nice outcome for most patients. Next, we'll talk about inflammatory acne. So that's the more traditional, like pimples that we think of when we think of acne, or pustules, like those pus-filled like whiteheads that come to the surface. So for inflammatory acne, it depends on how severe it is. Sometimes we can get away with just topical treatments, topical antibiotics and washes. But if it's more involved and it's deeper in the skin, then we do have to go to an oral antibiotic. Just to treat it systemically and really treat it basically from the inside out. There are other treatment options. We can also tailor the antibiotic, or if you don't want to use an antibiotic, there are other things we can do. So that's basically inflammatory acne. There's also hormonal acne, which affects women. And it's the acne that shows up in what we call the classic hormonal distribution, meaning like the beard distribution, where men would grow facial hair and have a beard, women can get acne. In those cases, we can use hormonal treatments. A medication called spironolactone is often helpful, or even just going on certain oral contraceptives can help kind of dampen that hormonal response or that hormonal acne. The most severe type of acne is called nodulocystic, and that's when it's very, very deep in the skin, very painful. Just to touch it, it's very tender. That we definitely have to use oral treatment. Sometimes an antibiotic is not enough, and we have to go to a treatment called isotretinoin or Accutane. Most people have heard of it, the branding Accutane. That involves monthly visits and blood tests as well to monitor the liver, and that's more for the more severe cases. So that's nodulocystic acne, and that's a very high risk of scarring. So we like to be aggressive and treat it so the scarring is minimized from what we can do. In addition to the active acne, we can also have changes from acne. You can have scarring. There are many different types of scarring. We can try to treat it. A little bit more difficult than the active acne, but there are several modalities we can use. And then even just what we call post-inflammatory hyperpigmentation. More common in people with darker skin types, but after you have an active pimple or an active lesion, sometimes the inflammation will go away, but you're left with a brown spot or a dark spot. And there are other things we can do topically or cosmetically to try to lessen that appearance. So we try to address the active acne and then the after effects of the acne as well.
Great. Thank you for teaching us about acne, Dr. Schwarz. If you have any questions about acne, please submit your questions in the comments section. Okay, and I did have one text come through. It says the person is asking, when does acne typically first appear?
So typically first appears from the ages of like 8 to 12, like I said, when that puberty first starts, and it tends to peak around the ages of like 16 through 18, and then it can kind of disappear into the 20s, but like I said, it can continue long after that.
Okay. Another question also came in. The person is saying, I'm in my 50s, why am I still getting acne?
So excellent question. So yes, you can get acne in your 50s or continue to have acne. It depends on the type of acne you have. For women, sometimes the hormonal acne can continue well beyond, in their 40s and 50s. The The other thing we want to think about is perhaps maybe it's not acne, maybe it's rosacea. There are subtypes of, or a subtype of rosacea that closely resembles acne, and sometimes it's hard to tell apart. So that's why it's important to go to the dermatologist. Okay, Rachel is asking, what are some of the treatments for acne scars? Is there anything we can do at home? So acne scarring is really, really difficult because the scarring is deep down in the collagen. Treatments that you do at home are typically most successful when you have something very superficial. Like if you have a superficial pigmented spot, you can kind of treat it topically. To do anything deep down in the collagen at home is difficult. In the office, we can do laser treatments, we can do microneedling, we can do certain peels that help with the acne, but at home is a tough sell to treat the acne scarring.
Okay, that looks like that may be it, Dr. Schwarz. Thank you so much for your time.
Sure.
And just a reminder to all of those viewing our production this evening, if any of you are interested in any product, we are offering 10% off in our online store. Go to our website at apderm.com. And our entire APDerm team and I thank our viewers for attending our Wayland Watertown virtual grand opening event. We hope you enjoyed it, and we hope to see you at our beautiful location soon. Have a good evening, everybody.
And now we'll be announcing the raffle winner for the Elta MD Skincare Basket. Thank you so much for joining us this evening. I hope you enjoyed our event, and we look forward to seeing you in our Watertown and Wayland locations.